Good morning, dear colleagues. I would like to thank Toshiba for giving me the opportunity to show you some of my work. That's one of my hobbies among fetal medicine, and I'm going to take you through some of the basics of the CNS anatomy in the late first trimester. Now, what can you see here? Tell me. Is there anything abnormal on any of the images? Yes? What? Acrania, yes. On the left or on the right? On the left. In axial and in a sagittal view, obviously one of the most common malformations. Now the pointer, just for the technique, the pointer doesn't show. Never mind. On the left top, acrania that can lead to anencephaly. Obviously, the skull is missing. It's always that is certainly a severe malformation, which is worth detecting early in pregnancy. The next example: is there something abnormal somewhere here? Any suggestions? Die Maus geht noch. No. You can see here the brain stem, quite narrow, the pons, the fourth ventricle. Here the same mesencephalon, pons, much wider, and the rest of the brain much narrower. That's the characteristic malformation that is associated with open spina bifida. So again, severe malformation, very common malformation, worth detecting in the first trimester, or at least suspecting in the first trimester to give the patients all the options, something where you will already have to look a bit closer. And now the main part of the anatomy begins. I've chosen that picture from the internet because it shows very nicely at the end of the embryologic development. Ignore the red lines, that just shows you Carnegie stage 23, the embryo is formed, it has its nose, its ears, but this drawing also shows the parts of the brain very nicely. And here in red, the telencephalon, in yellow, the diencephalon, then the mesencephalon, the metencephalon, the myelencephalon, and the spinal cord in green. The two at the top form the prosencephalon. The metencephalon, myelencephalon together are known as rhombencephalon. And by the way, everything below the diencephalon is called brain stem, except the cerebellum. And I'm going to take you through anatomical slices as anatomical specimens in 3 planes, starting with the sagittal plane. That's the familiar first view of the baby. Here, the comparison to this drawing with a fetus with a CRL of 38 millimeters, with a, of course, slightly parasagittal section, because you can see here the choroid plexus quite clearly in the telencephalon. Then this part would be and don't worry, I'm going to explain all these parts in greater detail in the next slides, the diencephalon, the mesencephalon, the metencephalon, and the myelencephalon. Here in magnification, the telencephalon. That consists, and I'm going to compare that now with histological, with anatomical specimens, some of which are more than 100 years old, partly from a collection from Vienna, from Hochstetter, and partly from the Carnegie collection out of this book I'm showing you here. So these are slightly parasagittal, as you can see on the line, a slightly parasagittal section plane, also from a fetus with a CRL of 38 millimeters. So they have a corresponding size, slightly parasagittal sections. Here the telencephalon, that consists of a thin, smooth cortex, which you can not really see on ultrasound, but you would know it is there. Maybe you can get an idea of the basal ganglia on the scan. Obviously, the most clear thing is the choroid plexus in the ventricle. The next part of the brain, the diencephalon here, that again, here on the anatomical specimen consists of thalamus and hypothalamus. That's a rather dark structure on the scan. So that's the diencephalon. Then the next bit, the mesencephalon here, again, a dark structure, dark because it consists of tegmentum and tectum, which is brain structure. But in the middle, there is a still very large aqueduct, which is called mesencephalic superventricle at this stage. The future aqueduct is very large at this stage. Then the next part is the metencephalon here. That consists of consists of the pons, which is often referred as the brain stem in publications on ultrasound, but it's obviously just part of the brain stem, so that's the pons. Opposite the beginning cerebellum that begins to develop here, in between the isthmus, and then below the future fourth ventricle, this little bright structure. Here is the choroid plexus of the fourth ventricle, which is often quite bright on the ultrasound as well. So that is the metencephalon. That together with the myelencephalon forms the is called rhombencephalon. There you go, that was the sagittal views. So what is most obvious on ultrasound, just to repeat, is obviously the choroid plexus, if you're slightly parasagittal. Then the dark structure is thalamus and hypothalamus, or if you're really in the middle, the third ventricle. The very large future aqueduct. Then the pons, and opposite the cerebellum, and the fourth ventricle. So these are the structures that you see quite clearly in the sagittal views at late in the late first trimester. Now we'll continue with the coronal planes. Just to remind you, coronal, that's the coronal plane. This is a specimen from the Hofstetter collection where you can see very clearly from the outside how smooth the brain is so early on. And I've chosen 3 sections to show you. At this time, from a fetus with a serial of 68 millimeters and the corresponding ultrasound image here on the right. The major difference you must keep in mind is that on ultrasound you have the skull. The anatomical specimen is without skull, so you must not mix that up on the image. Here, again, this thin, still thin, already slightly thicker, but still thin, smooth cortex, which again from this view is not really obvious on the ultrasound. You would just know where it is. Very clearly visible the choroid plexus and the basal ganglia are below. Obviously, it's a symmetrical structure. The next coronal section slightly further back through the thalami, again the smooth cortex on the outside, on the left side, and the skull on the right side. The thalami here, the hypothalamus, and in the middle, the third ventricle. And the next section, again, further, maybe I can leave that a bit longer. That's probably a bit short. So the third ventricle here, which, and then the third coronal section through the mesencephalon. Again, don't forget, this is the skull. Here, like in most structures, the most obvious thing are the fluid-filled spaces, are the ventricles. Here the aqueduct, surrounded by the mesencephalon, and part of it further back, already the pons. And then the third part are the axial planes. Again, these are planes you're more familiar with, you would often start your scan with. Axial planes are slightly tilted planes. Again, a brain from the Hofstetter collection, the smooth surface. And here again, I've chosen 3 planes, starting with the transventricular plane, quite high. And here, from this plane, like always on ultrasound, if you have structure that is perpendicular to your scanning angle, you can see very thin structures much more clearly, often much thicker than they would be in reality. But here, because of the different angle, you can also see on ultrasound, see the cortex quite clearly. I'll probably use the pointer again, or take that away again. You can not only see the choroid plexus, but between here and here, and here and here, you can see the cortex, the smooth cortex, at this stage. And as we've heard today, there are conditions with polymicrogyria that can start so early. And the plexus, the choroid plexus, and obviously it's symmetrical. The next plane, if you move the probe a bit further down in parallel, you reach the next plane. On this plane, you see the thalami, you're familiar with, and then the mesencephalon, and obviously also in this plane between part of the mesencephalon is the aqueduct. Relatively wide at this stage, not as wide as it was in the fetus with 38 millimeters CRL. And the third ventricle here. And then the third plane I've chosen, move the transducer a bit further down again. And here the pathological, the anatomical specimen on the left side in a greater magnification this time. You can see the cerebellum developing at this stage, the cerebellum and the vermis, quite thin structures, but with the on this plane it's also obvious on the scan at this CRL of 57 millimeters. In front of it, the fourth ventricle, and then the pons, or part of the pons. The plane is not exactly the same. So when you really look at the things, and when you're aware what is where, with these high-resolution transabdominal probes nowadays, you can get really very, very detailed and instructive views of the fetal brain. Thank you for your attention. And I'm going to demonstrate some of that now.
Thank you very much. Are there some immediate questions from the audience? Or can we move to the live scan? Okay, no questions. Then thank you very much for the excellent didactic presentation. And then we move to the...
Right, so I always ask the patient to, or I always check that she's in a comfortable position, well, first of all, because I'm a friendly person, and also because the more the abdominal muscles are relaxed, the better views you get. That makes a big difference. And of course, you say hello to the baby first, if it's one that is as nice as this one in the sagittal view. And then I usually check the size of the baby fairly early, so that I'm really aware of what to expect in terms of development. So a bit more than 6 centimeters CRL, about 12 weeks. And then I can, also ich muss das jetzt nicht enger machen, den Schallwinkel oder so. Nein, ich möchte nur den Kopf. And then I would, for the purpose here, or just let me just, yeah, let's look at the baby because it's such a nice position. I tend to look at the cord insertion and the placenta also in the beginning, but now, just in case the baby turns around, we'll go through what we've seen before. Obviously, the sagittal section you are very familiar with. You would see the skull and the round shape of the skull. Here you would measure, somewhere here you'd measure your nuchal translucency, I guess. You can see the nasal bone and the upper, the maxilla and the mandibula. And then the brain in the more or less mid-sagittal or slightly oblique structure. Often you can see the brain more clearly. And the mid-sagittal structures, like here, the thalami, obviously the telencephalon, the choroid plexus, fluid here. I might free, it's waking up now and exercising, which is good. Let's start with the so-called brain stem, the mesencephalon, the large aqueduct, the pons, the developing cerebellum at the back, and the I should decide for a section, maybe. And at this gestation, what you can also see is a gap between there. That's probably where the choroid plexus of the fourth ventricle develops, and behind that is the cisterna magna already. And the most important thing now clinically to look at is that your brainstem here, and you would also always be able to find that. Quite easily, because you'd find the thalami here in the mesencephalon, you'd find the thalami, and then it looks like a continuation, although here would be your aqueduct, but this in continuation, the pons here, you would always find that quite clearly, and then the line, the posterior border of the pons, to the next very clear line, which is the occipital bone. And I believe that if you see that this distance compared to this distance, you can always find that really easily, and as long as that is smaller than that, you can essentially exclude open spina bifida. Of course, if your posterior fossa is really wide, that can also indicate posterior fossa abnormalities. So it's worth to look at the relationship between these things. Now, between these lines. Now, the axial views. Where you would measure your biparietal diameter, and where you can see the cortex thin, smooth, just normal for this stage. The choroid plexus with fluid in the front and at the back. And if you then, if you then move further down, you would see the thalami, the third ventricle, and again further down, this view of the. No, that is not in such a. The angle is not exactly the one I'm looking on. The beginning, the development of the cerebellum here at the back, with the fourth ventricle in front here. That would be the developing cerebellum at the back. And then the axial views which I think are very beautiful and obviously very more and more in neurosonography in the mid-trimester, quite common, but in the first trimester maybe not so much used. The front through the frontal horns here. You can see the symmetry. And the corpus callosum obviously would not develop yet at all, so you would not expect to see this interruption of the midline here, like after 17 weeks. And then you'd see the thalami and then the posterior fossa again here.